Are you planning to get your teeth extracted during your menstrual period? Wait. Before doing so, listen to this first. Welcome to the Frantic Bonanza. This is Dr. Preeti,
And this is Dr. Anjali.
and here we unleash all the facts and discoveries just for you.
Dr. Preeti, I have a question for you.
Yeah, tell me, Dr. Anjali.
Yesterday, one of my previous patients who had molars removed a few days ago came to me complaining of a sharp pain on the same side of the extraction that radiated to head and neck area. She was also complaining of bad breath and bad taste. But when I examined the socket, it appeared empty and there was no blood clot formation. And one more thing, there was also a small bony portion was visible inside the socket.
It looks like a case of dry socket. Was the extraction very difficult?
No, it was just a normal case of extraction. But there was profuse bleeding which was very difficult to stop despite being a simple case.
So, was there any underlying medical history?
No, she's just a young adult patient in her late 20s and there was no medical history was reported to me.
Have you asked if she is on any medication like contraceptives or anything else?
No, she is not taking any medications.
So, when was her last menstrual period?
That I didn't inquire about. But how is it relevant to my patient case?
Actually, extraction and your menstrual cycle has a very strong relation. Menstrual cycle could be the determinant risk factor in frequency of dry socket. Back in 2013, Dr. Majid Ashpur and his colleagues conducted a study for this. They measured the association between menstrual cycle and frequency of alveolar osteitis, that is your dry socket. The study was a single blind design where patients with bilaterally impacted third molar underwent randomized surgical extraction, one tooth during the menstrual period and one during the middle of the cycle. And the predictor value was timing of menstrual cycle and was grouped as mid-cycle and menstrual period. The outcome variable was dry socket, which was measured at 2nd to 7th day postoperatively. A total of 145 female patients with mean age of 24 years underwent 290 third molar extractions. The overall frequency of dry socket was 23.4%. Although the frequency of dry socket was significantly greater in mid-cycle than during the menstrual period in both the oral contraceptive users and non-users, but there was a significant difference, that is, the frequency of dry socket was greater in oral contraceptive users than non-users in the mid-cycle, but no difference was found between the two groups during the menstrual period. The researchers concluded that menstrual cycle could be the determinant risk factor in the frequency of dry socket and recommended that elective procedures should be performed during the menstrual period in both oral contraceptive users and non-users so that they can eliminate the effect of cycle-related hormonal changes on the development of dry socket. So, in case you need to get your teeth extracted, try to avoid it during your menstrual period. And always remember to tell your dentist about your menstrual cycle so that you can avoid such scenario in the future.
I hope you enjoyed today's video and if you want to watch more such videos, do give it a thumbs up and we will see you next Tuesday with more such interesting facts and discoveries. Have a good day.